My name's Trish Bleth. I'm the peer development specialist here at Terros, and I've been here close to 2 years. Back when I first was diagnosed, it was back at a time in my life when, probably the lowest time in my life, and I really didn't have much help for myself. I was fortunate enough to meet two people who guided the way for me. We kind of have a saying that sometimes you're not able to hold on to hope for yourself, but others will hold on to it for you. And then when it's time, they give it back to you. And I want to be able to give that back to others. I want people to know that just because you have a diagnosis or you're recovering from an addiction, it's not the end of the world. I think it's important for people to know that we can have a life, yes, but we can also have a life that's worth living. When I share my story with people, I want to make sure that I share something that relates to them and where they are in their journey. I really want to concentrate on where I am today so that people see that life is not limited. And so when I'm working with others and training them or sharing with them how they should share their story, I try to focus on those points with them and let them know that when we're sharing our story, it's about the person we're sharing it with. I first started in one department, and I met an employee there, fellow peer staff member, and she said, "I don't know if you remember me, but I met you 7 years ago. You were speaking at a community event, and you were sharing your recovery story and talking about working and how that was so important to you in your recovery and your family and having children and grandchildren." And she says, "And I looked at you and thought, I can do that too." And she says, "I have kept you in my heart all this time, and now you and I are working together." I can't tell you what that meant. The importance of the training is what they bring to it. And they bring so much with their lived experience. And it's exciting to see how many of them want to give back.